Massive renovations are underway at Mpilo Central Hospital in Bulawayo as government accelerates major rehabilitation works under the Presidential Hospital's rehabilitation program, an ambitious national initiative aimed at modernizing public health facilities and improving healthcare delivery across the country.
It is the first major overhaul of Mpilo since the hospital opened in 1958. The program seeks to revitalize key hospitals through structural upgrades, state-of-the-art equipment, and improved patient care. At Mpilo, several major projects are already in motion. The renal unit has been equipped with new modern dialysis machines, boosting the hospital capacity to manage kidney-related illnesses, and work at the tuberculosis laboratory is nearing completion. A total of $358 million United States dollars has been allocated for Mpilo's refurbishment, with $199 million already utilized. Officials say the investment is a clear demonstration of government's commitment to strengthening the health system and improving access to quality care closer to home. Similar work is ongoing at Parenyato Group of Hospitals in Harare. Acting Director of Operations, Phineas Tole, said the renovation program is progressing smoothly.
The works are going quite well according to schedule. Yeah, because I think we are starting with the C, we are doing the C block and the D block. So if you look at the C block, they are now starting to do the internal fittings, and we are renovating, refurbishment, and improving. So some improvements are starting to be put in place in the C block. The ceiling, everything is now in place. So according to us, the floors, they are also starting to show some demonstrations on the floors. And the windows, I think they've put the frames on the windows, these aluminium frames. So to us, they're doing quite, it's still within the schedule.
Sitole said the facelift was long overdue, with many sections of the aging 67-year-old institution suffering from roof leaks, cracked floors, and broken windows.
From the framework, what we are seeing now happening in the world, that it will be a very, very big turnaround in the environment, the hospital environment at Mpilo. Yeah, with a lot of modifications, which will be according to the current standards of hospitals.
The upgrades are expected to ease the burden on patients, especially those from rural communities who have long been forced to travel for specialized treatment. Mpilo Central Hospital Chief Medical Officer Dr. Nasisius Zwanga recently said work that has been completed so far is already bringing relief to patients from the 5 provinces of the southern region in the country.
We are the only hospital in the southern region in the public sector with a renal unit providing hemodialysis. The last figures that I got were about 54 patients on our books, and the service is free. And those who have had an opportunity to tour the renal unit, it's one unit you can be proud of. Recently renovated, machines have been replaced with the modern new hemodialysis machines. We currently have high impact projects running at Mpilo, mainly the solar plant, which I mentioned earlier on, which is almost 95% complete. We've got the upgrade of the National TB Reference Laboratory. The superstructure is 90% complete.
Hospital authorities stressed the need for staff and patients to protect the new infrastructure. The rehabilitation of Mpilo forms part of a broader push towards equitable national development, ensuring all regions benefit from modernized, well-equipped public services. For ZTN Prime, I'm Andile Chuma in Bulawayo.